Hi, this is Kelly Lewis, and this is my video discussion board post, and the debriefing on the simulation that we watched for class. The first debriefing question is, tell me where you saw caring exhibited in the scenario. I saw caring when the nurse was educating the patient on diaper changes, um, and I saw that she, showed concern to her coworker, um, talking about acknowledging that the patient was homeless and had previous drug history, and I guess she kind of almost insinuated that maybe she was drug thinking, but she didn't actually show that caring compassion to the patient. She never acknowledged the patient's concern about being homeless or the issues with her medication, or her ride home, and she didn't follow up with the education that she provided to make sure that the diaper change would be successful. Asking if the patient has any questions is not really clarifying the teaching that she had done. She should have asked the patient to teach back, to show her what she had learned, to observe that she was comfortable with that. The second question is, tell me what behaviors you observed that were not caring behaviors. And I think I just touched on that a little bit with the first question. Sorry, you guys are nosy today. The behavior that stands out the most to me was when she cut the patient off. When she told, when she didn't acknowledge that she didn't have a home to go to, and she cut her off when she asked her if she had a ride home, and she didn't provide her any like case management consult or any follow up on those issues. So that was a big lack of caring and compassion that I noted. The third question is, how would you respond in this situation? I would, and I have been in this situation as a labor and delivery nurse. I definitely would have contacted case management and called the doctor. So case management maybe could help her with having a place to go at discharge, and the doctor, she could have gotten her medication changed, or at least allow the doctor to make that decision, because it's not a nurse decision to make. The fourth question is, tell me about the priorities in the scenario from the patient's viewpoint and from the nurse's viewpoint. The nurse's viewpoint, her priority was clearly to get this patient out the door so that she could have that bed available. And I know sometimes we do feel pressure to clear the bed, but that should never be our priority. So that was clearly the nurse's priority. The patient's priority seemed like that was hard for me to tell. I think the patient was just kind of going with the flow. And I know she seemed, in that short snip of time, she did seem a little focused on the medication issue, but it seemed like she might have been seeking help, but was shut down very quickly by the nurse. And the next one is, tell me about resources that could be offered for this patient. Resources that I know we have available are case management. We have a shelter in Hampton Roads that we can send patients to, and the case manager always, arranges those things. Could talk to her about, does she have WIC? Does she know how to obtain WIC? Support for the baby, and offering her information on parenting classes that our local children's hospital offers, giving her a printout of the available dates for those, and any other resources that the patient could use would be, really, it seems like, maybe even with her history with drug use, asking her if she has any issues with that, and does she need help, does she need to talk to somebody, maybe a counselor. And again, a case manager would have been our best bet in this situation, because she really would have had the time to focus and hone in on those issues. The last question is, how would you transfer what you have learned here to the practice setting? From the simulation, I guess I learned how not to talk to a patient, and I hope that I've never made a patient feel the way that that nurse really just made me feel from even watching it. Um, not to be rushed. I try to never tell my patients that I'm busy, even if I have, a room, a floor full, and people in the waiting room. I don't let the patients that I'm caring for know what's going on because I don't want them to be concerned with anything but the care that I'm giving them. Um, so that's what I took from the simulation. So I can't wait to read you or watch your guys' videos and chat about our simulation. Thank you.